Welcome to Integrity Linguistics Institute.
You mentioned the risk of patients developing venous thromboembolism. What exactly should I be looking for?
I think it's very important to be aware of the guidelines, but to remember that in practice, diagnosis is complicated. Swollen legs are a typical sign, but patients may or may not present with that, or the swelling may be difficult to detect if the patient is either obese or very thin. Maybe the patient has calf pain or is breathless but doesn't have any other symptoms. If you're at all suspicious of VTE in a patient, refer them urgently for investigation. Actually, though, most cases of hospital-associated thrombosis occur after discharge. We should ensure there's a regular clotting profile so that appropriate preventative or therapeutic interventions can be made, and organize any prescriptions they'll need on discharge.
All right. Now, in this question, if you know the strategy over here, if you have clarity on what the question is asking you, this is a very easy question. But if you don't have clarity on what the question is asking you, then this is a tough question. So I'll play the audio once again. All right. So I'll play audio once again. So listen to the audio once again and see if you're able to find the answer. Audio script.
You mentioned the risk of patients developing venous thromboembolism. What exactly should I be looking for?
I think it's very important to be aware of the guidelines, but to remember that in practice, diagnosis is complicated. Swollen legs are a typical sign, but patients may or may not present with that, or the swelling may be difficult to detect if the patient is either obese or very thin. Maybe the patient has calf pain or is breathless but doesn't have any other symptoms. If you're at all suspicious of VTE in a patient, refer them urgently for investigation. Actually, though, most cases of hospital-associated thrombosis occur after discharge. We should ensure there's a regular clotting profile so that appropriate preventative or therapeutic interventions can be made, and organize any prescriptions they'll need on discharge.
All right. Now, all right. So now let's take a look into the question, right? So what's the question over here? You hear a senior nurse, right? So whose voice are we hearing? A senior nurse over here, right? And what is the senior nurse doing? This senior nurse is advising a trainee, right? So a trainee is a junior person, right? A junior intern and all. So this senior nurse is advising a junior nurse about a condition called venous thromboembolism, that is abbreviated as VTE. Now, this is the question this is your duty over here. She stresses that the trainee should. Okay. Now see, what is the key word over here? She stresses. Stresses basically means what? She is not casually saying it. Okay. She is not casually saying it. Okay. She is saying it with emphasis, right? So as you can see over here, there is emphasis. She is putting more stress. She is putting more, importance to that one particular message over here, right? So this is what this is what the question duty over here is. So here as you can see, we have three answer options. We have A, B, we have B, we have C. And the OET, they will talk about answer option A, they will talk about answer option B, and they will talk about answer option C, right? Everything they will say. But maybe, let's imagine that, one answer option is being said, okay, but it is wrong, but it is casually said. Okay, so it is an instruction. Okay, so let's say that the person over here, it is an instruction, but that instruction is casually spoken, right? Now we have another instruction, but that instruction over here is not casually spoken. That is given some emphasis, right? So which instruction will you choose? Again, as I told you, this single word over here. So since this word over here, you cannot choose the instruction that is casually spoken, right? Here the question is asking you which instruction is she giving more emphasis. So here you should give it to an instruction where the speaker is giving more strength into it, more power to it. So see, every single word in OET has a purpose. And you should, with a very clear, calm mind, you must be able to understand what your purpose over here is. Without that clarity, this is going to be extremely tough. Right. So here, there is a lot of instructions being given, but some are casually told and some is told with an emphasis over here. Right. So this is the meaning of she stresses that the trainee should. Now, what is answer option A? Answer option A is the trainee should pay special attention, right? Special attention to identifying these symptoms, right? So the senior nurse is telling, okay, when you are dealing with a patient with venous thromboembolism, okay, you must give special importance to the identification of the symptoms. That is the what answer option A is telling. Now, what is answer option B telling? B is telling ask for help immediately. So ask for help immediately whenever there are any concerns, any basically wants, even if it's a small concern, if it's a big concern, so any concern you have to go and immediately ask for help. That is, she's telling you are a junior, okay, you are a trainee, you are not an expert. So when you're dealing with a patient who has venous thromboembolism, any difficulty, any concern you have, don't do it yourself. Go and ask someone's help. That is what she is giving importance to. Answer option B. What is answer option C? She is stressing that you follow the standard treatment procedure whenever possible. Right. Whenever possible means any situation. Right. Any situation, you have to follow the standard treatment procedure. Now, see, standard. See, for example, when you're going to a jewelry and when you're going to purchase, gold, you will say BI, what is it? BIS 916 hallmark, right? So what is that? What is that? That is what we call as the gold standard, right? That's what we call as the gold standard. And also, when you're purchasing a cooker, when you're purchasing an, electronic equipment, you say ISO 9001, 2000. So you must have heard these type of documents. I mean, these type of phrases. What are they? These are all standards, right? So there is a gold standard over here. So ISO 9001, 916 hallmark and all that. These are all standards. And here the person is saying, any opportunity you get, whenever possible, you always have to follow the standard treatment process. That means you cannot disobey the standard treatment process. That is the textbook knowledge. Okay, whatever the textbook is saying, exactly what is mentioned in the textbook, that only you have to do. That is what answer option C is telling. Right. All right. So now let's take a look into the, yeah. Okay. So over here, so like this, you have comprehended the question. So remember, what are the 3 steps over here? Step number 1 is comprehension. So I'll just type it down over here once again. So step number 1 is comprehension of the question, that is understanding the question. Then comes retention, that is registering the information to your memory. And then comes detection, that is going and finding the answer. Right. So comprehension is done using the keyword analysis. So you must take your pencil, you must underline, you must circle the important word. That is what we call as the keyword analysis, right? And then you have to register that information to your memory. You must not forget the question. You must not forget what your duty over here is. Then what you need to do now, when you're going to listen to the audio, when you're listening to the audio, your eyesight should only be in the answer options. When you're listening to the audio, your eyesight should only be in the answer options. It should not be anywhere else. Because as I told you, when the audio is playing, when you're reading the question, you are going to distract yourself. Right. So let's just read the question once again. And let's go to the transcript. So we listen to the audio 2 times. So she stresses, right? So which information she is giving more importance? Venous thromboembolism, senior nurse. So who's the main speaker over here? The main speaker over here is the senior nurse, right? This is the main speaker. So the answer over here will come from the main speaker. So when you're listening to the audio, you have to give more importance to the nurse over here, not the trainee, right? So the trainee over here is the what? This is the second speaker. right? This is the second speaker or the listener, we can say, right? So this person is not important to us, right? This person is more important to us. So what's our duty? Which instruction she is stressing that the trainer should do, compulsorily should do, right? Answer option A, pay special attention to identifying the symptoms. Answer option B, ask for help immediately. Answer option C, follow the standard procedure whenever possible, right? So like this, you should have the memory of the question to your mind, right? So this is why they give you 15 seconds time. Now you have to go and listen to the audio, right? So let's take a look into the transcript over here. So first of all, the trainee is asking over here, you mentioned the risk of patients developing venous thromboembolism. Now see, the trainee is asking, what exactly should I be looking for? Okay, so here the trainee is asking, okay, when I am dealing with patients who have a risk of developing this particular condition, what should I look for? Right. So now the main speaker, right? So from whom are we getting the answer? We're getting the answer from the main speaker over here. So the main speaker is saying this. So let's see what the main speaker is saying. So the main speaker is saying, I think it is very important to be aware of the guidelines. Now see, this is stress over here, right? See, I think it is very important. So that's a stress. So someone is she's stressing over here to be aware of the guidelines. Now see over here, when you hear this word guidelines, your eyesight, where should your eyesight go? Your eyesight should go to answer option B, right? See, what is the synonym for guidelines? The synonym for guidelines is standard treatment procedure. So the same thing, right? Standard treatment procedure is the same thing as guidelines, right? So when you hear that, immediately your eyesight should go to answer option C. Right. Now, what is the answer option C telling? C, she is telling you have to follow. Okay, that is, you have to follow the guidelines whenever possible. That is, any chance you have, any opportunity you have to strictly follow the guidelines. That is what answer option C is telling. Right. But in the audio over here, what is saying? It is aware. Okay, so here there is a very big difference between being aware. So she's be aware. So this is not follow. So she's not telling follow the guidelines. She's saying you must be aware. That means you must be knowledgeable, right? So there it is follow. So this is not the same thing. Okay, awareness is different. Follow is different, right? So here they're talking about the guidelines. So your eyesight should go to answer option C. And let's see whether she's telling this is what they have to do. I think it is very important to be aware of the guidelines. But now she's telling, but to remember that in practice, diagnosis is complicated. Now what is she saying? Okay, but when you are practicing in real life, okay, so guidelines is theory. Okay, say what is guidelines over here? Guidelines is theoretical and this is practical. So she is telling theory is important. Theory is important. She is saying that, but what is she saying? Now she is saying, but, okay, now that's a contrast marker over here. Contrast markers I will explain to new students later on. Okay, now she is saying in real practice, practice basically means what? Practice basically means real life. Okay, in real life, it is actually very complex. So which means the theory is important, but in practice, always it is not going to match. Okay, practicality is a little bit different. The diagnosing is little bit complicated. Right. So she's saying you must be aware of the guidelines. She's not saying you have to follow the guidelines anyway, because in real life, in real practice, the diagnosing things is a little bit complicated. So which means you have to think outside the textbook. See, this is how you have to decode the information, one by one. Right. Now she is talking about swollen legs are a typical sign, but patients may or may not present with that. And swelling may be difficult to detect if the patient is either obese or very thin. Now, what is the patient talking about? I mean, what is the person here talking about? Now, see over here. Now, the person is talking about signs. Swollen legs. That's a typical sign. Typical sign means a common sign, right? Swelling. Okay. Obese. or very thin? What are these things? And also over here, okay, maybe the patient has cough pain or is breathless but doesn't have other symptoms. Okay, now see, what are all these words referring to? Cough pain, breathless, symptoms. What are all these things? Swollen legs, swelling, obesity, very thin, cough pain, breathless, and all symptoms. Now, where should your eyesight be? Now, your eyesight should be in answer option A, right? Now, they're talking about the symptoms over here. All right. So now they're talking about answer option A over here. All right. Identifying the symptoms. See, symptoms is what we're talking about. Now, your eyesight from answer option C. Say, I'm giving you practical tips. This is how your brain should work. So, first, when you hear the word guidelines, your eyesight should go to answer option C. And you have to confirm. You have to confirm whether they are telling you have to follow. But this is not mentioned. Okay, that is, you have to follow the guidelines is not mentioned whenever possible, right? So we don't know whether C is the right answer option or not. Now they're talking about symptoms over here. So now your eyesight should go to answer option A, right? Answer option A is talking about symptoms, right? Now what is the keywords over here? Pay special attention. Okay, here she is talking about paying special attention to identifying the symptoms. Right. So now your eyesight is an answer option A. So let's see whether the person is talking about the importance of identifying the symptoms over here. So she is just telling swollen legs are a typical sign. Okay. Patients may present with that, may not present with that. Okay. Swelling may be difficult to detect in patients who are very obese or thin. Maybe. Now see, maybe. Okay. Now see, there is a lot of may over here, right? See, may over here, maybe over here. Okay, maybe over here. Maybe the patient has cough pain or is breathless, okay, but doesn't have any symptoms. Now, see, when the speaker over here, when the speaker over here is talking about, when the person speaker over here is talking about symptoms, she is not giving symptoms any importance. Right? She's saying may, sometimes the patients may have this, sometimes the patient may not have this. Okay, so as you can see over here, there is a little bit of vague importance given to symptoms over here. But what is answer option A telling us? A is telling you have to pay special attention to identifying the symptoms. So this is not what the person is saying, right? Symptoms are talked. Okay, the symptoms, the keywords are mentioned. So this is mentioned, symptoms are mentioned, and also this word also, standard treatment procedure, this is also mentioned, right? But paying special attention, that is, she is stressing you have to give super attention to identifying the symptoms. Are we getting that kind of information from the speaker? No, right? We are not getting that kind of information from the speaker. And here as well, okay, you have to strictly follow the guidelines. Are we getting that kind of information from the speaker? No, right? So like this, partially, right? So partially they will mention the correct answer, right? But that will not be, and entirely it will not be mentioned. So you have to give importance to, all these factors as well. Right. So anyway, let's keep listening. Okay. So we have not yet eliminated. We have not yet eliminated any answer options yet as of now, but we just have to still wait for the correct answer. Now over here, as you can see, remember what the question is asking. The question is asking you what the trainee should do. So she's stressing what the trainee should do, right? Now see over here. Now here the person is saying, if you, now see over here, if you are, now see, if I am giving you an advice, if I am giving an instruction, I will use this word. You have to do this. You have to do that. You must do this. You should do this. So I will use this word. Okay, you, right? So what's the question asking you? The question is asking you what the senior nurse is telling the trainee to do, right? Now see over here, they are not, this word is not mentioned, you are. So here it is just background information, right? So all this information over here, okay, the previous to this information, we can say it is just background information. Right, it's just background for it. It is just telling the importance of guidelines. It is just telling what are the symptoms, normal symptoms, okay, or normal signs. So it is just background information of venous thromboembolism. Right. But the question is not asking you to identify the background information. The question is asking you what instruction is given to the patient by the senior nurse. Right. So see here, if you are at all suspicious, now this is an instruction. See, now the emphasis is coming. If you become suspicious, if you doubt there is VTE in a patient, you have to refer them urgently for investigation. So what is the person telling over here? If you're dealing with a person and if you suspect that the patient is suffering from VTE, don't handle the patient on your own. You have to refer them urgently for investigation. Right? Now see over here, what is answer option B telling us? Answer option B is telling us ask for help immediately. Okay, whenever there is any concerns. It's a completely paraphrased version. They are using synonyms over here. So if you have any concerns, you have to ask for help immediately. So see, what is the person telling over here? If you are suspicious, that is, if you are concerned that the patient is having venous thromboembolism, you must refer them urgently. Urgently means immediately. Immediately, you have to refer them for investigation, which means you have to ask for help immediately. This is what she is stressing. Now, see, this is the instruction that is she is giving directly to the trainee. Before that, before all these things, we can say it is just background information. Right, background information, right? Immediately, urgently, see, immediately, urgently. Right, and this is the instruction over here. Now, although most cases of hospital-associated thrombosis occur after discharge, we should ensure there is a regular clotting profile and so that appropriate preventative and blah, 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 organize. See, all these things. These are all what? These are all background informations. See, all these things over here and all this information over here. This is not a instruction that is given. It is just background info. So here at the beginning, they are just introducing, okay, the importance of guidelines, what venous thromboembolism is, what the common symptoms are, and after discharge. Okay, and here they're talking about after discharge, what they should do. Ensure that there's and here is a clotting profile and all that. Like it's all related to preventative and therapeutic interventions. So we can say that the answer that we're looking for is right over here, right? And what's the sentence? If you are suspicious. And the key word, right? So the key factor that gives you an importance, that gives you, the clue that they're talking about the answer is this. If you are, see, this is the instruction that they are specifically giving this person. So when you listen to this word over here, your mind should become activated, right? So we can say that answer option, what? Answer option B is going to be the right answer. Ask for help immediately if there is any concern. So if you have any doubt that the person is suffering from so and so, you have to refer the patient urgently. So B is, so this is what she is stressing. See, she is not casually saying it. If she's giving more importance to urgently. Okay. So this is what the instruction she is stressing the trainee should do. Now see, answer option B, A over here, symptoms. Okay, this keyword is mentioned. Okay, she is talking about the symptoms. But is she talking about paying special attention to identifying the symptoms? No. She is not telling you should identify the symptoms. You should you should categorize the patient according to symptoms. Is she telling that? No, she's not saying that, right? So since it is partially only mentioned and partially it is not mentioned, A is eliminated. And what about answer option C? Standard treatment procedure. This is mentioned, right? This is mentioned over here. But what is the action over here? You have to follow. Okay. That is not mentioned. And that is, we can eliminate answer option C in the beginning itself, because see over here, that what is the person telling? In real life, diagnosis is complex, is complicated, right? So that means theoretical knowledge is insufficient. So this information we are getting from the beginning itself, right? So in the beginning itself, the person is saying, okay, we have guidelines, we have standard treatment procedure, but in real life, diagnosis is very, very complicated. So theoretical knowledge is insufficient. That means you have to use your own common sense when you're dealing with in real practice. So in the beginning, so a very smart student will be able to eliminate answer option C immediately, right? So like this, the first answer option they will eliminate is answer option C, then, answer option A, and then they will listen to the instruction over here, and that is to refer the patient immediately. That is ask for help. So B is indeed the right answer, right? So I will just play the audio once again, right? So this time, just listen to the audio and see if you're able to understand why B is indeed the right answer. Just give me a second. Audio script.
You mentioned the risk of patients developing venous thromboembolism. What exactly should I be looking for?
I think it's very important to be aware of the guidelines, but to remember that in practice, diagnosis is complicated. Swollen legs are a typical sign, but patients may or may not present with that, or the swelling may be difficult to detect if the patient is either obese or very thin. Maybe the patient has calf pain or is breathless but doesn't have any other symptoms. If you're at all suspicious of VTE in a patient, refer them urgently for investigation. Actually, though, most cases of hospital-associated thrombosis occur after discharge. We should ensure there's a regular clotting profile so that appropriate preventative or therapeutic interventions can be made, and organise any prescriptions they'll need on discharge.
All right. Now, okay. So that is the answer to the 28th question.